Here's my old pal, Mark Liponis. This guy may have one of the best jobs on the planet. He's the chief medical guru at Canyon Ranch. That means he has to alternate his time between a mansion in Lenox, Massachusetts, a floating mansion somewhere in the Mediterranean on a boat.
It's not that time.
Yeah. Well, a number of years ago, Mark convinced me to go through a battery of tests at the Canyon Ranch. So I was pricked, I was poked, they drew a ton of everything, they threw me up on stress machines, and holy cow.
This is for your physical.
After a while, he came back. And he kind of looked me hard in the face, long stare, and he said, "Not bad." Being a Canadian, I knew that was a rave. That was a fabulous pass.
And we found something special.
And he found something special, and that's what I was leading up to. He says, "I've got the immortality gene." This, of course, has led to reckless behavior on my part.
But it's okay.
But I may get the pass. It was great news, and you know what? Hope heals.
Just be careful crossing the street. So this is my mom. Probably the most kind, gentle, giving person I've ever met. 79 years young. She's amazing, always a smile, a good word, very kind. She knows how to stay active. She plays hard. She knows how to have fun. Here she is dancing at my son's graduation last month. She works hard. You know, every time she comes over, I get her to mow the lawn. She plays hard. She really taught us what's important in life, and you know, a lot of that is how to stay healthy. And you know, my mom had three simple rules. And at 79, she's still going strong. And you know, the rules are eat right, exercise, and don't smoke. And I think it's good advice because obesity and smoking account for two of the largest preventable causes of death. And so I think that is really good advice. But the question is can we do better? Can we do better than the advice my mom would give you, and that is to eat right, exercise, and don't smoke? And this really ushers in this new idea that we're now calling personalized medicine. You've probably heard about it. And it's usually talked about in the context of some sophisticated testing, like Moses had, to find out that he has the immortality gene. And most people think that if you know your genes, that will tell you what to do, you know, what medicines you should take and what diseases to watch out for. But, you know, the genes don't reveal everything, of course. The genes don't reveal where we live, what we've done, how we behave. Those factors aren't accounted for in our genes. And so I think there's an even better and more important way to personalize medicine so that we really can get a better result. Now, in Moses' case, he found out that he has this immortality gene, so he can do whatever the heck he wants. No problem. He'll live forever. In fact, he has to get hit by a truck. But for most of us, we can figure out how to personalize our care, I think, in other ways that are really quite simple and pretty inexpensive, I think. You know, I'm not an expert on Canadian healthcare, but I do know a lot about U.S. healthcare, and it's not a healthcare system. It's a sick care system. And we do a great job with that. You know, if you're ill in the U.S., it's a great system because you can get quick care, you'll get effective care. But what we don't have is really health care. It's not about health. Because honestly, when it comes to being sick, you want your doctor there. But when it comes to being healthy, it's about us. We're in charge of our health. And that means to take the steps that we need to stay healthy. And maybe that's, yes, eat right, exercise, and don't smoke. But there might be more. So what I've done is put together a few ideas for you about how you might personalize your own health care. And you know, I think, the U.S. healthcare, sick care system is one that's really reaching its capacity. As Rex told us day one, you know, when a system exceeds its capacity, we're about to head for a crash. I'm afraid that's very, very true. And as Jeff Rubin told us, we really need to learn to live with less. And so more of the onus is going to be on us to stay healthy, to take care of ourselves. So how would we do that? I've got some ideas, and I've got a few little props here about how you might even personalize your own health and health care. I put this all together for a pretty inexpensive cost, and we'll go over some of the costs of this. First, a few things that you want to know about yourself that actually help you to personalize your own health care. The first is how much you weighed at birth. How many people know their birth weight? Keep your hands up. Of those with your hands up who know your birth weight, how many of you were a first or only child? Yeah, see, that's what I find. The third child never knows their weight. You know, the first child knows the length, the height, the weight. They have the footprint, the fingerprints. The third child, you barely have a picture. So you got to go back and figure out what you weighed, because the birth weight actually helps you to figure out what you should do. If you were between 6.5 and 9.5 pounds, that's the normal birth weight. But believe it or not, outside of that range, if you were less than 6.5 pounds or if you were more than 9.5 pounds, that actually identifies someone who later in life will become a diabetic. That's someone who later in life will develop cardiovascular disease. They'll get high blood pressure. They'll develop heart disease. They're likely to have stroke. And it's interesting how the birth weight is a great predictor of that. And it really doesn't matter why you were a little baby. But the short answer is the reason why. If you were a small baby, you had some stress in the womb, and when you were born to be programmed for a more stressful world. And that more stressful world meant that maybe food was scarcer, your mom didn't have the food, or maybe there was a problem, and you had to be you were a smaller baby, so you were built to survive in a more stressful world. And that programmed you to become a more diabetic person with heart disease later in life. The growth and reproductive history is also important, especially for women. Did you know that the faster you grew as a child, the more likely you are to develop breast cancer during your life? If you hit your peak height at an earlier age, if you were tall for your height at age 14, those all identify women who are more likely to develop cancer later in life. It also has to do with reproduction, of course. If you went through puberty earlier, if you didn't have kids, or maybe you went through menopause later, you ovulated more. That, again, is an important risk factor for breast cancer. So I always get a good history. The pet history is actually interesting, and the birth order, because we found that if you grew up with pets, especially dogs, or if you were a second child or later, and with older brothers, you're actually more resistant. Your immune system is better. You actually are less likely to have allergies. You're less likely to have asthma. You're less likely to have eczema. You're less likely to develop an autoimmune disease during your life. Whereas if you were a first child or an only and you didn't have pets growing up, you're more at risk. And that's because your immune system didn't get trained on the germs that the older brothers and the dogs brought into the house and you got exposed to. And so the lack of that training leads to a sort of attack later on in life. So these important parts of the history help me as a physician to help to personalize someone's care. The next thing you want to do is get out this very expensive tool that I use a lot, the tape measure, and you want to get a neck measurement. And it's interesting, the neck measurement, you're saying, what am I, Taylor? No. The neck measurement actually helps to decide or to determine if you might be at risk for a very common sleep disorder known as sleep apnea. Now, that's something that you might have heard of. It's a very common disorder, underdiagnosed. It's a major cause of cardiovascular problems, heart disease, hypertension, obesity, and it has a lot to do with your anatomy. More to do with your anatomy, honestly, than how many drinks you've had or your age. And so one way to measure that is just by simply measuring the neck circumference. Now, if you're greater, again, than 40 centimeters around, you're at risk, or that's about 18 inches. There's two other things you can look for, and for that, you want to get out your mirror. And you get out your mirror, open your mouth, look in the back of your mouth. Now, don't stick a toothbrush in there or anything. And what you're looking for is number 3 there. That's the uvula. If you can open your mouth, look in the mirror, and see the uvula, you're in good shape. That means there's plenty of room in the mouth. It's unlikely that your mouth is going to be...
Hi.
Sorry.
I just want to fashion.
Thank you.
Go.
It's unlikely... It's unlikely that your airway is going to occlude. If you can open your mouth, see the uvula, that means there's less crowding. But if the uvula, the palate is lying low, the tongue is high, you're at risk for obstruction. There's one other thing you want to look for with your mirror, and that is look for scalloping of the tongue. You see this tongue, the edge of that tongue is scalloped. And what does that mean? That means that the tongue is so big, or the jaw and the teeth are so small, that the teeth are indenting the edge of the tongue. So when you stick out your tongue and you see an indentation on the tongue, you know that there's crowding in the airway, and that's someone else who's likely to obstruct their airway at night. Now, how does that help you? Well, the main way it helps you is it helps you to decide how to sleep. What we found is that this is very related to someone's position. If you've got a crowded airway and you sleep on your back, that airway is going to become obstructed. But if you sleep on your side, or if you're on your belly, you're okay. So we've instituted a very expensive treatment, and that is we sew a pocket into your nightshirt, and we stick a tennis ball in there, right in the back of your nightshirt. And that way, every time you roll over on your back, get up on your side. And after a few nights, you pretty much figure out that you better stay on your side or you're going to have an uncomfortable night's sleep. So that's one way to personalize your health. And again, just take a simple thing, the tape measure and the mirror. Now, while you have the mirror, do this, and that is look at your back, because you don't know how many moles you have back there unless you got a friend that can take a look at that for you. If you look at the mirror and you see a lot of spots back there, please go check out with your dermatologist, because if you have moles like this that could become cancerous, that's important to have that looked at. The next thing is back to the tape measure again, and probably the most important and the most inexpensive personalizing test you could do is the waist to hip ratio. Now, this is a great test, and this shows how to do it. You take the measurement of the waist right about the level of the belly button, or maybe an inch above. You can do a little sample of bacteria while you're there. Then you get the hip measurement, which is right over the widest part of the hips and includes the butt. And it's interesting, this little test holds up in men, it holds up in women of all ages, and of all weights. It's not just about being overweight. In fact, even if you're a normal weight or low weight, this test is valuable. And what it tells us, actually, is how sensitive your body is to the effects of the hormone insulin. Insulin is that hormone that controls our blood sugar. It regulates a lot of bodily functions. It's the one that, if it's not working right, could lead to diabetes. And what we've learned is the bigger your belly is relative to your hips, the more at risk you are to become diabetic. Now, that's not everybody, because as you know, as some people gain weight, they get bigger hips. Some people get bigger all over. Other people get a bigger belly. Well, if you're in the bigger belly category, that's the person who's going to become diabetic. That's the person who's going to develop high blood pressure, who's going to get heart disease and stroke. So I already know, just by measuring your hips and your belly size, if you're someone who's headed in that direction or not. Now, what would you do differently? Well, if you're going to become a diabetic, you need to change what you're eating, and that is you need to reduce your sources of sugar in your diet, and that really means particularly the carbohydrates. And, those come from grains. So in my practice, when somebody has a bigger belly than they have a butt, then I'm cutting back on their grains. I'm telling them they have to eat less grain because the grains get converted to sugar, and the sugar, of course, drives someone farther down the line towards diabetes. Now, no one gets off easy, because if you've got a bigger butt than hip, than belly, you're still at risk, and of course you're not going to get cardiovascular disease, but you're going to get cancer. Of course, you got to get something. There's no free rides. So then I want to look for more cancer. So this, again, helps you to really personalize. And the cutoffs, by the way, are 0.8 for women and 0.9 for men. So if you take your waist measurement, divide by your hips, if you have a number less than 0.8, you're not going to become diabetic. You're not going to develop cardiovascular disease as likely. On the other hand, we have to watch out for cancer. On the other group, if your belly's bigger than your hips, then we have to watch out for more diabetes, more cardiovascular disease. It helps to, again, personalize. This is all outlined in my book, The Hunter-Farmer Diet Solution, but the real basic difference is how sensitive someone is to the hormone insulin. Insulin is that hormone that, again, regulates our blood sugar. And the more sensitive you are to insulin, the less the chance of diabetes. And there's a way to check it easily with a blood sugar check. And this is a simple little home test. It's at less than $10. You get all the kit that you need. You get the little strips. You get the meter. You get the little lancets that do a painless finger stick. And you can measure your blood sugar. Now, you've had it measured because you've done it at your doctor's, but there's a few things that you might want to know. First, if you check your blood sugar in the morning, it should be less than 100. After a meal, it should be less than 200, and 2 hours after a meal, it should be less than 140. If your levels are above that, you're in the hunter category, heading for diabetes. So a simple check for less than $10 that you can do before and after a meal. If you are diabetic or heading in that direction, one of the main diseases, of course, affects the eyes. The diabetes affects the eyes. And one of the things that affects is this macula, the center of the vision. And there's an easy test that's free for macular degeneration. It's the Amsler grid. And this simple test, you look at the center of the grid, at the dot, and you should see sharp, straight lines across the grid. If you're looking at that, and you have to be about this far, I'm not sure it works at that distance, but if you're looking at the center of the grid and the lines are wavy, or if you're missing corners, you should get a checkup to see if you may have this macular degeneration. And of course, the eye is an extension of the brain. And one of the best ways to test the brain, which I think is just fascinating, is checking the sense of smell. Now, this great company, Sensonics, has just made this cool little card that's a scratch and sniff test for your sense of smell. And the reason this is so important is in the nose, we have specialized cells called the granule cells. They're the smallest cells in the nervous system. And they're the first cells affected by Alzheimer's disease. And what we've learned is that if you're heading to Alzheimer's disease, the first symptom is the loss of the sense of smell. And so this is a very easy test. You can sniff, you can scratch this little patch, you smell it, and you circle the right answer. That one happened to be cinnamon, but you can also check between coconut and garlic and motor oil, turpentine, chocolate, strawberry. It's a $15 test. That's probably the earliest warning sign of Alzheimer's disease. So I love that method of testing and knowing. Now, what would you do differently? Well, that's someone who may need to change their diet. They may need to exercise more. They may need to take some fish oil. They may need some preventive or protective medications if they're headed down that road. The next test is an easy test for the lungs, and this is about a $7 or $8 test that can check for inflammation in the lungs that triggers asthma. It's called peak flow. It's very simple, plastic device. You blow as hard as you can. I got a 600. Men should be over 500, women over 400. If that happens to be low, you're at risk for asthma. If you are, then we need to control your environment, clean your air, get a filter in your air. We need to treat you potentially for allergies because that's the most likely trigger for asthma. A simple test, the blood pressure and pulse. You've all had it done. And this is a device that, people say it's expensive, but I think this is worth the investment. This is mine. I brought it from home. It's simple. You put your arm in it, you push the button, it gives you a blood pressure reading. Now, everybody's had their blood pressure checked, but maybe what you don't know, and by the way, Pulse, there's a cool little app for your iPhone that you can get now from Izumio that checks your pulse using your iPhone or your Android phone just by using the camera. Your blood pressure should be 120/80 or below at rest, but with exercise, it's important. Nobody checks your blood pressure with exercise. Get on the treadmill, do some exercise, then check your pressure. It should be below 210/110 in men, 190/100 in women. A high blood pressure with exercise predicts someone who will develop plain old high blood pressure, hypertension, and may need preventive measures, restricting sodium, losing weight, etc. Now, your pulse rate should be 220 minus your age. That's your maximum pulse. But what you should know is you should be able to recover about 20% of your pulse rate in 2 minutes after exercise. So you go to the gym, you work out, you get on the machine, you check your pulse, you rest for 2 minutes, it should be down 20%. If it's not, then we know you're at risk for more, you need more cardio exercise. Now here's a good one, grip strength. Simple device, it's maybe not worth the investment, but if you squeeze this, you should at least get 37 kilograms for a man. If not, your risk of disability is tripled in the next 20 years. So just grip strength. 2 very simple home tests, a stool test that checks for blood. This is especially important because one of the most important tests is finding blood in the urine and in the stool. And if you find that, you could have an infection in the stomach with this common infection called H. pylori that right now affects about 30% of Canadians, about 25% of Americans, and in some places around the world, more than 75% of the population. It's a leading cause of ulcers, but it can also cause bone marrow problems, eye problems, joint and skin problems. This simple test, a urine strip, you just pee on this and it tells you if there's any problem with the urine, blood in the urine. I'm especially fond of this test. Why? I found blood in my own urine 18 years ago. That led to a diagnosis of kidney cancer when I was 36 years old. I lost a kidney. It could easily be detected and found early if you do a simple home test like the urine blood test. I couldn't go on without mentioning the stamp test because there's been so much talk about sex at this conference, and this is a home test for sexual function in men. And that is you get a roll of perforated stamps, you apply it at night to the shaft of the penis. In the morning, you should wake up with the perforations broken. If not, there's a problem. It could be a problem with circulation, or a problem with testosterone, easy to check for. The last test, and I only spend a second on this, get naked. Get naked, stand in front of the mirror. Why? People don't look at their alignment. The alignment is so key. Here, you can see on the left, an ankle that's pronated. That ankle puts more pressure on the knee, on the hip, on the spine. I see so many people in their 50s and 60s, and they don't understand why did I need a hip replacement? Why did I get a bad knee? Why did I need a replacement? Look at your ankle. That threw everything off. The cost of this, well, the cost of the tape measure, $4. The blood pressure cuff, $42. The glucometer, $10. The urine strip, $12, etc. Your health, priceless. So please, take my mom's advice, and yes, eat right, exercise, don't smoke, but also learn more about you so you know what you have to do to stay healthy. Thank you.
fit in.
No, you got it all. That's fantastic.